Thank you for joining today. My name is Vanessa. I am our Vice President at Customer Success. Today, I have our CEO and founder, Samad Syed, with us, and an office manager, Camille Becker, with Anantuni Dental. Her journey with mConsent has been great so far, and I'm really excited to just get you guys to talking about what she's done, what she's looking forward to doing, all the good stuff with her.
Thank you, Vanessa. Thank you for introducing, and thank you, Camille, for coming with us today here. And where are you based out of, if I can ask you?
Yeah, so we're in Chandler, Arizona, which is one of the suburbs of Phoenix. It's an honor to be here. I'm excited to share our success and our story and our business with everyone.
So we are from three different parts of the country. Vanessa from Minneapolis, myself from Dallas, and you're from close to Phoenix area. So that's great.
Yeah.
Awesome. So the purpose of this podcast is just to understand some of the things that the dental practices are working with. The first question I want to ask you was when I was thinking about talking to you, the first question that came to my mind is that what are the top 3 challenges that dental practices are facing today? And you as an office manager, what can you point us towards?
Patients. So new patients, patient activation, insurance, and patients. Those are the biggest challenges we have. Having patients come into the building, finding you, knowing who you are, understanding what your practice is about, making sure they come back once they're here, that they understand the importance of coming back and being engaged in their healthcare with the healthcare team. And then, of course, going through insurance and payment options to be sure that the offices get paid and that patients maximize their benefits, because the vast majority of patients are paying for their insurance. They should have the benefit of the insurance, and then making sure that they understand once that's happened that they can come back again, because we have their
you are spending a lot of time, I'm assuming, in educating the patients about, hey, this is good for you. You have insurance, use it, don't lose it. Right, and
absolutely
sure the benefits that they have, they're utilizing those benefits. That's number one. And what I'm hearing from you is also that when they come in, they feel welcomed. I mean, and you're educating them about the oral health. Why is it important to take care of? Don't just ignore your oral health. And I think that's what I'm hearing from you.
Absolutely, yes. We want them to be an active, engaged member of their healthcare team. The insights that they bring with them, everything, all the aspects of their life. Our office is very much about foundational whole body dentistry. So what's happening outside in your life, your medications, your other health concerns, your oral health is a direct reflection of that. And so we want our patients to be engaged in the healthcare team. And we want them to know when they come in the door that we are their advocate. We're here to help support them and get them what they need to be on the road to happy, healthy.
Awesome. So, to do that, I do see that as a task, a huge task at your hands. How do you prepare your team to take on that? I
think that the first thing is making sure that we have the right software pieces and procedures in place to do that. And in our office, mConsent is a huge component of that. We've recently consolidated and decided to go with mConsent for full service. So that's been a big change for us. We're able to get paperwork from patients, insurance information for patients, communicate real-time texting, and having staff that is able to engage with computerized processes like texting and emails really makes a difference with how fast and how quickly and efficiently we can deal with insurance and deal with patients.
What would you tell somebody who hasn't experienced what you have experienced so far, right? What would you tell somebody? They're still on paper, they're still working on phones mostly. What is the difference that you have seen when you start using the technology in general on using mConsent in this case? What would you tell them?
It's the same adage we've always heard: work smarter, not harder.
I like that.
Everything for insurance is digital and available online now. So stop wasting hours and hours of your staff time on the phone. Get online, be engaged with the patient portals, use services like mConsent has for insurance verification. I mean, the new insurance verification service is quick. You put in a name, you put in a birthday, you put in a number, you find out if the patient's active. That's the basic information we need to at least get started and get you in the door So work smarter, not harder. I'm not a paper person. I'm very much a digital person, which is I'm kind of at the outside or an outlier for my age category to be so digitally engaged. And I think that it's the answer to practices being efficient for the future.
What do you mean age factor? You look very young.
I'm almost 50, but I'm very, very much engaged with digital networks, digital platforms, and how that works. So I very much mConsent's been a big deal for me because I've been able to engage with all of the digital paperwork, all of the electronic verification, and it makes my job easier. It also means that I can work from home. So like, for example, yesterday I wasn't feeling well, but I was still able to engage with my new patients and my staff while I was home because your nifty little app shows up on my phone, which is awesome.
That's awesome, isn't it?
I love it.
So how do you use the app for? Let me get that little bit of insights on that. How do you use the mConsent app when you're at home?
Right. So for me, it lets me see what's going on with my schedule and what's happening in the office in real time, which that is a huge component. A lot of the other services that we've used in the past don't engage in real time. So if somebody makes a change, you didn't know what was happening. But now with that real time engagement, I can see what's happening in my schedule. I can also text my staff through the team messaging app, which means that I can let them know that I'm paying attention to what goes on with patients. I can text my patients. So if I see a message or call come in that is specifically for me or something that I was engaged on, I can reach right back out to the patient. And patients don't know that I'm not sitting at my desk in the office. They're getting the same service that they always get, which is fast, efficient service from Anantuni Family Dental. They don't know that we're in another place. I also have a hygiene coordinator who works from home on the weekends, and she uses the text to pay feature and the balance feature that we have in order to reach out for patients to help them with their accounts. And again, it's the same thing. Patients don't realize that they're engaging with someone that's not in the office. For them, it's the same extension of our 5-star service that they get all the time. So that means a lot to me that I can reach out to patients and that there's no change in the process. It looks the same.
What do you think about basically when you text it out to patients compared to sending paper mail for collecting the invoices? What is your take on that so far?
The response rate to texting is about 90 to 95%. The old methods of sending postcards and that to patients, and I know there's still some doctors that are all about that. I think the efficacy of that is probably less than 30% because, at least for me, I get all the advertisements in the mail, I stack them all up and I stick them immediately in the recycle bin. So I don't even bother to pay attention.
Yeah, I do the same.
Right. So the texting is, it's in patients' faces and it's in their communication stream. And I mean, let's face it, we are a generation of society connected to our phones. So if I make myself relevant and connect myself to your phone and connect my practice to your phone, then I become something that you think about more readily because I'm not a postcard stuck to the fridge. And that's where engaging with patients makes a difference in how we can get them back into the office and staying engaged with us.
Absolutely. That's amazing. If I can ask you about what does a successful month looks like for Anantuni Dental? What do you call a successful month?
Well, I think as with anything, any business, we're always looking to meet production and collection goals. So we're looking at those numbers and making sure that we engage with staff and with the doctors to meet those production goals. But I think the real success in the month for us are the patients that we are able to reach, that we are able to help, that have a change in their oral health or have a change in their smile. And that's when we know that we've had a month, when we've had a week, a time that has been the most important. And we do celebrate big things in the office. I mean, we have patients that have celebrated 100 birthdays with us. We have a staff member getting ready to celebrate 50 years in dentistry with us this coming spring. So those are successes for us that we share with patients in the month. The other one are successes where, maybe a patient we haven't been able to reach, suddenly we're able to see them again and we reconnect with them and we hear about their families. Or that one lingering insurance claim that's just been out there forever, and suddenly one day the check shows up in the mail and you're like, party my desk, because you've had success with that. So I think it depends on where you see your success, but smiles are the biggest success for us. Happy, healthy, bright smiles. That's a successful day and month for us.
That is so awesome. What would you tell, somebody who's trying to do similar stuff, but they're, struggling? What are the couple of pieces of advice for somebody who's listening to you and saying that, hey, tell me 2 things that I need to do in 2024 that I'm not doing right now?
So if you're not using electronic services, you should pick up the phone and call Vanessa or Nick at mConsent. They're my heroes right now. I think that's probably one of the biggest tools is, as we've gone through it and as I'm looking forward to the year, is really boosting all of my staff's engagement with your software, with the mConsent software, to be as successful as we can. I think that's where you have to be for 2024. I think the other thing is I think you have to look at yourself and find out whether or not you're relevant and staying relevant. And so being engaged with digital platforms, with texting platforms, email platforms, text-to-pay services, those are the things that make us relevant. I mean, let's face it, the whole world can pay on their phone. So if you can't pay on your phone and you can't text to pay from your phone, then you're missing a whole generation and a whole group of people that you can't engage with. So I think that's what you are looking for in the next coming years, especially the rest of this year and next year, is having that social media and digital presence with patients and just being accessible to them whenever they need you. 2 in the morning, 2 in the afternoon, on a Saturday, just having that engagement. And that mConsent does give me that option. I can reach patients all the time. They can reach us after hours. We can get photos for emergencies. I mean, there's more than one occasion where somebody sends a picture and we're like, yep, we're on our way in. We'll help you out. So I think that that's where you have to be engaged and stay relevant with your patients.
Absolutely. And the way things are moving fast, we do see AI coming into play.
Yeah.
And those are a few exciting things that are coming along. So I'm going to give you maybe like an insider update. Is that there is an AI that is AI portion of voice where we can help offices during their off-office hours, where after office hours, I should say, where there is a AI who can take a call and schedule an appointment for the patient if needed. So the way the tech is moving fast, it's moving fast, I'll tell you that. And I understand that, offices are taking care of the patients and offices are there to take care of the patient. That's their number one thing, where they're looking to make somebody's lives better, improving their smile, making it better. So our job is to help you guys out, and we're here to listen to you and say that, hey, listen, this is what we're working on. We'll let you know when things are there. Let's make it happen.
Nice. I'm looking forward. An AI receptionist would be nice. I would get some of my evenings and weekends to not pay attention.
Yeah.
We use some AI in the office now. We use AI for x-rays. It helps doctors evaluate x-rays. So we do use that software. And then I use AI software actually for insurance claims. Being able to use AI software to write a narrative or write an appeal sometimes is helpful because it pulls from so many other sources, where I only have it in my head, but AI can pull from other sources and help me be more effective with patients. So we do use some of that now.
That's a great idea. That's a thing I think a lot of people who are listening to this can start taking advantage of, is used for your insurance claims instead of yourself. There are ideas that you can implement to use AI. What do you use? ChatGPT? And
I do use ChatGPT, and I also use a service called Freed that helps write clinical notes. Yeah.
Awesome. Any questions for us, Camille, before we wrap this up?
No, I couldn't be happier with the service. I mean, we've moved everything over from another service to mConsent and partnered with your phone company as well, which is Mango. And I've been really happy with the transition. The one thing I have to say, and I think that if you're looking to switch to a service, there's not been a single time that I have called and not gotten a person. And for me, that is the testament to the business's focus on customer service and support, that a human answers the phone every time. I don't have to go through a list of automated services. I know who I'm talking to, and it means that I can be more effective in my job because I don't have to have anybody waiting on the phone to get to someone. So I very much appreciate that. That is a huge component for me when I'm deciding to work with the business, is what their customer service and support looks like. So I commend you guys for having that. I know it's hard in this day and age to have that many people available, but that's been a big thing for me, is having those calls are just right there, answered all the time. It's how I am in my business. Here in the office, 3 rings and I expect a human to pick up. And I get the same service from mConsent. So I very much appreciate that.
Thank you. That's huge for us. That is something that we are striving for. And your testimonial for that is so pleasing to hear. That helps us to be more motivated to do better than what we are today. So thank you so much, Camille, and really appreciate you taking time out and talking to us and telling us how you feel about that product. These are the things that helps us to move forward fast and will keep us motivated to help you guys better.
Of course, my pleasure. I'm happy to be here. I appreciate giving the opportunity, and hopefully you make it to Phoenix someday.
Yeah, I'm looking forward for that. Thank you.
You're welcome.